Welcome to Out-of-State Inpatient Utilization Review by Health First Colorado. Table of Contents. About KEPRO, Scope of Services, KEPRO Services for Providers, Provider Responsibilities, PAR Submission, Response Times, PAR General Requirements, Medical Rule for Medical Necessity, Out-of-State Provider PAR Guidance. EPSDT. KEPRO follows to the EPSDT requirements for all medical necessity reviews for Health First Colorado members. Medical necessity reviews on treatments, products, or services requested or prescribed for all members ages 20 years of age and under are based on compliance with the federal EPSDT criteria. Medical necessity is decided based on an individualized, child-specific clinical review of the requested treatment to correct or ameliorate a diagnosed health condition in a physical or mental illnesses and conditions. EPSDT includes both preventive and treatment components, as well as those services which may not be covered for other members in the Colorado State Plan. For more information, please review the EPSD website at hicpuf.colorado.gov/early-and-periodic-screening-treatment-EPSDT. About KEPRO. In 2021, KEPRO was awarded the Colorado Department of Healthcare Policy and Financing contract with the state of Colorado for utilization management and physician-administered drug review, including outpatient, inpatient, specialty, and EPSDT. In addition, KEPRO will administer or participate in Client Overutilization Program, COOP, annual HCPCS code review, quality program, reporting, review criteria selection, customer service line, appeals, peer-to-peer, and reconsiderations, fraud and false claims reporting. Scope of services: audiology, diagnostic imaging, durable medical equipment, medical services included but not limited to select surgeries such as bariatric, solid organ transplants, transgender services, and elective surgeries. Out-of-state inpatient services, outpatient physical and occupational therapy, outpatient speech therapy, pediatric behavioral therapy, pediatric long-term home health, pediatric private duty nursing, physician-administered drugs. KEPRO services for providers. Provider portal access is located at portal.kpro.com. It's available 24 hours, 365 days in a year. For those who are unable to attend the System 2.1 or 2.2 training, please see the below links to view the recordings. System training materials, including video recordings and FAQ, are located at hicpuf.colorado.gov/par. The provider manual is also posted on hicpuf.colorado.gov/par. Provider communication and support, please email coproviderissue@kepro.com. Provider responsibilities. Providers may request prior authorization for services through our direct data entry portal, Atrezo. Utilization of this portal allows the provider to request prior authorization for services, upload clinical information to aid in the review of prior authorization request, and submit reconsiderations and/or peer-to-peer requests for services denied. Check the code you are requesting against the fee schedule to ensure a PAR is required. The fee schedule is located at hicpuf.colorado.gov/provider-rate/b-schedule. Always verify the member's eligibility for the Health First Colorado prior to submission by contacting Health First Colorado. The generation of prior authorization number does not guarantee payment. The system will give warnings if the services requested have been previously authorized or if a PAR is not required. PAR submission. PAR requests submitted within business hours 8 a.m. to 5 p.m. Mountain Standard Time will have the same day submission date. The Trezzo portal is accessible 24/7. However, those submitted after business hours will have a receipt date of the following day. Holidays will have a receipt date of the following business day. Days following state-approved closures, such as natural disasters, will have a receipt date of the following business day. Turnaround times. The turnaround time for a PAR review completion will be extended to ensure a thorough and quality review of all PARs, decreased number of unnecessary pens to request additional documentation or information, Improve care coordination and data sharing between KEPRO and the department partners like the regional accountable entities and case management agencies. Note, for additional information pens, the provider will have 7 business days to respond, and if there is no response or insufficient response to the request, Keeper will have 2 business days to complete the review and technically deny for lack of information if appropriate. Turnaround times. Expedited review is a PAR that is expedited because the delay could jeopardize life health of a member, jeopardize ability to regain maximum function, and/or subject to severe pain. Rapid review is a PAR that is requested because a longer turnaround time could result in a delay in the Health First Colorado member receiving care or services that would be detrimental to their ongoing long-term care. A rapid review may be requested by the provider in very specific circumstances, including a service or benefit that requires a PAR and is needed prior to the HCPUF's member's inpatient hospital discharge. A lack of DME supplies that immediately and adversely impact the Health First Colorado member's ability to perform activities of daily living. Same-day diagnostic studies required for cancer treatments, genetic or molecular testing require amniocentesis. Standard review is one that the majority of cases would fall under as prior authorization request is needed. These requests will be completed in no more than 10 business days. PAR submission general requirements. KeyPro's PAR request for OOS and fax exempt providers is located at hicpuff.colorado.gov/PAR. Information on general requirements is also located in the provider manual. A detailed step-by-step process for submitting both outpatient and inpatient requests can be found in the provider training manual at hicpuff.colorado.gov/PAR. Timely submission means entering the request before services are rendered and with enough advance notice for the review to be completed. Requests for additional information will be initiated by KeyPro if and when there is not substantial supporting documentation to complete a review. It will be necessary to provide supporting documentation with your submission. Supporting documentation may include, but is not limited to, office visit notes, laboratory results, imaging results. PAR process. After your request is faxed in and submitted for review, the provider will receive the following responses via phone call from a clinical reviewer upon review. Approval. Met criteria. CCR applied for the service requested at the first level was approved at the physician level. Request for additional information. Information for determination is not included and vendor requests this be submitted to complete the review. Technical denial. Health First Colorado policy is not met for reasons included but not limited to the following reasons. Untimely request, requested information not received, lack of information, duplicate to another request approved, service approved with another provider. Medical necessity denial. Physician level reviewer determines that medical necessity has not been met as submitted and has been reviewed under the EPSDT as appropriate. The physician may fully or partially deny a request. Reconsideration request. The servicing provider may request a reconsideration to KEPRO within 10 days of the initial denial. Peer-to-peer request. An ordering provider may request a peer-to-peer review within 10 business days from the date of medical necessity adverse determination. Definition of medical necessity. Medical necessity means a medical assistant program, good, or service. A, will or is reasonably expected to prevent, diagnose, cure, correct, reduce, or ameliorate the pain and suffering or the physical, mental, cognitive, or developmental effects of an illness, condition, injury, or disability. This may include a course of treatment that includes mere observation or no treatment at all. B, is provided in accordance with the generally accepted professional standards for healthcare in the United States. C, is clinically appropriate in terms of type, frequency, extent, site, and duration. D, is not primarily for the economic benefit of the provider or primarily for the convenience of the client, caretaker, or provider. E, is delivered in the most appropriate setting or settings required by the client's condition. F, is not experimental or investigational. And G, is not more costly than other equally effective treatment options. Out-of-state providers. All providers must be enrolled in the Health First Colorado Medicaid program in order to participate and receive service authorizations. Out-of-state providers may initiate enrollment with Colorado Medicaid by going to colorado.gov/HCPUC/provider-enrollment. Out-of-state providers must complete the inpatient prior authorization request form to document evidence that the provider has a valid Colorado Medicaid provider ID. The request is a service that requires PAR, exclusions, emergent admissions, outpatient services by providers not located in Colorado, border town. The request is for a service type keeper reviews for Help First Colorado members, example, inpatient admission or transplants. The request is for an out-of-state molecular genetic testing labs with a valid Colorado Medicaid ID. Date of service requested. The out-of-state services are medically necessary and not available in Colorado or the consumer's local approved border town. Clinical information about the requested services and why they are medically necessary include letter of medical necessity and evidence that the member's health would be endangered if required to return or remain in Colorado for treatment. Occasionally, the services may be available in Colorado for most members, but documentation may establish that the services are not available in Colorado for this member due to the unique medical needs. Failure to acquire a service authorization for services requiring an authorization may result in non-payments for the services rendered. Out-of-state provider PAR information. Keeper will append all out-of-state inpatient prior authorization requests to Colorado HCPUF with review summary, appropriate clinical documentation, and determination recommendation prior to any decision being rendered. Information submitted to Colorado HCPUF will include, but is not limited to, referring Colorado provider's letter of medical necessity, as well as the out-of-state admission procedure cannot be performed in-state, documentation to support medical necessity for admission procedure. The department's medical director will then agree or disagree with the submitted recommendation, and Keeper will take appropriate steps provided by the department, included but not limited to approval, medical necessity prior authorization denial, technical denial, requesting additional documentation. The company will notify the provider via fax, portal, or mail the determination. Colorado state regulations regarding out-of-state medical care for Medicaid members is located at 10 CCR 2505-10 8.013. Thank you for your time and participation.